I want to thank Rhode Islanders for tuning in to the 1 o'clock press conference. I hope you find it helpful. Each day, we're going to have a lot of news as we start to roll out more parts of the reopening. And then everything here, as it relates to reopening, will be posted at reopeningri.com. So hopefully you can get all the information you need. We're doing the best we can under very difficult circumstances to provide you with up-to-date information, and I hope you find it to be helpful and a helpful source of information. Like no time before, we are in this together, and I hope that you continue to be kind, continue to be patient, continue to be flexible, even as it gets harder. There is a light at the end of this tunnel. Very clearly, I see that light. I am confident around where we are. We are in good shape with our containment of the virus. We're going to together have a good summer. We're going to start to get back out there slowly, steadily, with a new set of rules, not being reckless, being careful, but just hang in there with us. As hard as it is, we're going to get there. And you can very clearly see that light now at the end of the tunnel. And by the way, it's because of your good work, because of your following the rules, that we are out of the crisis mode and beginning the recovery mode, which is going to be long, especially the economic recovery, but we're going to get there. Just as a reminder, tomorrow at this event at 1 o'clock, I'm going to start to talk about Phase 2, when we might get to Phase 2, what Phase 2 might look like. So that'll begin tomorrow. Over the weekend, we do not have these press conferences as a recognition of the fact that things are changing. We're not doing the press conferences on Saturday and Sunday. And on Monday, in recognition of Memorial Day, I'll be doing a video, and we'll be doing a special live Memorial Day celebration at the Veterans Cemetery in Exeter. And I believe that's at 11 o'clock on Monday. Okay, so big update. We announced our launch of our Crush COVID app 2 days ago. And as of 10 minutes ago, 25,000 Rhode Islanders have downloaded the Crush COVID RI app. That's awesome. That's terrific. I'm so pleased. That's blown away all of our expectations. In only 48 hours, 25,000 Rhode Islanders have taken the 10 seconds it takes to download the app. If you haven't done it, please do it. Take out your smartphone. You can do it on Google Play or the Apple App Store. It's called Crush COVID RI. Crush COVID RI. And I want you all to do it. This morning I was on a Facebook town hall for older Rhode Islanders. And I pulled out my phone with my app on it, and pretty much everybody else did as well. So I was so proud of you. On the app, you can get all the information you need. It's like everything at your fingertips. You can figure out how you can have groceries delivered. You can figure out what the latest information is about the virus in Rhode Island. You can figure out if you need to get a test, get tested for the virus, where you can go to get tested for the virus. And then there's a location diary feature, which I would like you to enable, and it will track your location as you move around. That lives only on your phone, and then if you get tested positive, you'll get a call from the Department of Health, and they'll ask you, can they have access to your location diary? If you say yes, great. If you say no, then they'll ask you to read it to them so they can know everywhere you've been, and we can really pinpoint our response and go do contact tracing to the people who you've been in contact with. Anyway, way to go, Rhode Island. 25,000 downloads. Let's get to 30,000 by tomorrow. Yesterday, I spent a minute talking about Memorial Day. I just want to take another minute to do that again today. It's supposed to be a beautiful weekend. I think we could use some beautiful weather and sunshine, and that's great. I hope you get outside and enjoy it. I just want to remind you, there have been no changes to the travel policy, which means if you leave the state, if you come home, you're in quarantine for 14 days. And there have been no changes to the 5-person social gathering limit. So if you find yourself this weekend in your backyard or someone's backyard at a barbecue with 20 other people, you're not doing the right thing. And I know that is a huge bummer. It's one more weekend. It's one more weekend. Please hang in there and go to the park. You can go to the beach. You know, Monday, East Matunic and Scarborough are open. Goddard Park, Lincoln Woods, all the state parks are open. You can have a lot of fun, but I'm asking you, please just do your very best. Do your best. Wear your mask if you go out. Wear your mask if you go shopping. Stay home if you're sick. And if you have a party, just remember the social gathering limit is 5 people. And as I say, tomorrow at this press conference, I'm going to be giving guidance around phase 2, what it might look like, and when it's going to begin, when we hope it begins. Last week, I had what I thought was an exciting announcement, which is that we are going to have summer camp in the state of Rhode Island this summer. Starting on June 29th, we are enabling, allowing, and in fact, encouraging summer camp. Kids have been cooped up for a long time. It's hard on adults. I think sometimes it's even harder on kids. And they're kids who are serious, young people who are serious athletes, serious artists, serious dancers, want to go to summer school, need to make up classes, just need to be with one another, get out, be healthy, live their summer, and we want to make that happen for them. Mental health is just as important as physical health. And physical health is more than just keeping yourself safe from the virus. Keeping yourself safe from the virus, it's keeping yourselves healthy. I will say it is a very disturbing thing that child immunizations are as low as they are. It is a very troubling thing that folks aren't seeing the doctor or aren't going to the hospital when they need to. So to that point, summer camp is a really important part of a child's emotional, physical, and mental well-being. So as of June 29th, we're going to have summer camp in Rhode Island, and I'm really talking to all the folks out there who provide summer camp. Please figure out a way to do it, because our kids need it. So today, right after this press conference, we're going to have full guidelines for summer camp on the Reopening RI website. And so if you're a summer camp provider, this afternoon, go to Reopening RI, and you can have all the details. Having said that, let me give you a flavor for it here in brief, because I know there's a lot of anxious parents who want to know, can my kids go and what will it look like? So it's not going to look the way it did last summer. It's not. It's going to be great. It's going to be fun, but it's not. There's going to be rules, and we're going to have to follow the rules. We're not going to have groups of greater than 15 kids or people. So we're going to keep the group size to 15. We want these to be stable groups. So we don't want your kids to be in one group of 15 on a Monday and a different group of 15 on a Tuesday. We want it to be the same group of 15 each day. And the same is true for staff. We want your children interacting as much as possible with the same adults. So it's very stable groups day to day. We're going to have rules around drop-off and pickup. We're going to be very careful not to have big clusters of drop-off and pickup. We're going to do our best to have some social distancing. The camps are going to have to obviously do a lot more cleaning. Again, later today we'll have this all online, but I want to give parents some comfort that the camps are going to have to follow these guidelines, which will include sanitation protocol, cleaning protocol. They're going to have to screen your kids every day to make sure your kids aren't sick. So every day before your child goes to camp, there'll have to be a person who screens them to make sure your kid isn't sick, have a fever, sore throat, aches and pains, etc. We're going to be asking for lots of hand washing, 20-second hand washing, lots of hand sanitizer. We're going to be asking the adults to wear their masks. We're going to ask the kids to wear masks if and as appropriate. Look, for the little kids, that's going to be really hard. Certainly in sports camps, really hard, if not impossible. But depending on the nature of the camp and how old the kids are, use some common sense. And here's what we know. If 2 people have a mask on, it's much more effective than if only 1 does. So we're going to ask you to do your best with the kids. But we're also realistic. It's going to be hot, and we know that kids, some of them will have a hard time keeping a mask on. So anyway, those give you a sense of it. We have a graphic I'd like to ask to be put up on the screen right now. It's a visual of what camp might look like. And today online, there'll be a lot more of these visuals so you can get your head around it, so it seems normal. But as you can see in the visual, the children are in stable groups. The groups are separated from one another, and they'll be with the same adult. The adults will be washing their hands frequently. There'll be lots of cleaning, and the adults will be mask wearing. As it relates to sports camps, we encourage sports camps. We want these kids to be physically active during the summer. That's what kids do. It's good for them in so many ways. The challenge, of course, is that if you're in a group of 15, you can't play a team of 10 against another team of 10. So sports camps will have to be more focused on technical skills, drills. To the extent that it's team-on-team sports, it's going to have to be small groups, 7 against 7. You're going to have to get creative. I have confidence you'll figure it out. But there will be camp, there will be sports, it'll be indoor, it'll be outdoor, pools will be open, and there's just going to be new rules. We all got to get in the business of following the rules. By the way, if you look around the country, look around the world, the countries that are doing best with the virus are the ones where the citizens follow the rules. I get asked all the time, Governor, are you going to fine people? Are we going to put people in jail? Look, if we need to fine people, we will. But I don't want to do that. I want to be in the business of people following the rules. So we're putting the rules out today. Camp won't start until the 29th. You have several weeks to start getting creative and just ask yourselves, how can we follow the rules to keep people safe, and how can we get creative to do that? It's going to be good for our economy, good for our children, good for our families, and I think even good for our parents. I would want to say one last thing. That we are asking all summer camp providers to create a COVID plan, a COVID-19 control plan, and to submit this plan to the Department of Human Services. It's probably going to be in the form of a checklist. You'll have to certify yourselves that you have a plan to do the sanitization, you have a plan to keep the kids in small pods, you have a plan for pickup and drop off, and down the checklist. But I'm saying that because I want parents to have confidence that if a camp is open, you should feel safe sending your children, because we're going to make sure that they're following the rules and that your children will be safe. So later today, reopeningri.com, much more detail than I've just given. I hope it's helpful. We have a few weeks. We're going to work with you to get it right. I want to take a minute to talk about congregate care settings, communal care settings, developmentally disabled group homes, DCYF groups homes, assisted living, and most particularly nursing homes. Obviously, if you look all around the world, all around the country, the greatest crisis that we've seen is in nursing homes. It's kind of a perfect storm in a very sad way. We have many older, sicker, more frail individuals living in close proximity to one another, and lots of staff coming in and out. Sometimes staff works at more than one home. It's made it very, very challenging to control the rate of spread the rate of disease, and sadly, the rate of mortality in these nursing home settings. Relatively, Rhode Island has done a good job. But, you know, relatively, if it's your mom who's in a nursing home, you don't want to hear that. You want to hear, you know, what more are you going to do, Gov? And I understand that. And every day we're trying to do a little more. And we are getting better and we are getting smarter. And the folks in the nursing homes are working their tail off and they're getting smarter. But especially in some of these nursing homes, when you have a communal bathroom, they don't even have individual bathrooms, the infection control is difficult, very, very difficult. So in recognition of the fact that it is so difficult, we have put a great deal of resources into helping our nursing homes and to support them. And I thought I would just give you a window into what we're doing. We have put in, we set up a system called the Congregate Setting Support Team System. We've put together teams. They're interdisciplinary teams. People from the Department of Health, DCYF, Department of Labor and Training, the National Guard, the Disaster Medical Assistance Team, EOHHS. It's a cross-department support teams. And these teams go on missions. You know, I listen in on these calls, sometimes I oversee the calls, and they think of themselves as going in on a mission. They get a call from a home that's in need, a call that's struggling, a home that is struggling to do cleaning, to do testing, to figure out what infection control looks like, and then we send the team in, hands-on assistance to that nursing home on a mission so that we can keep your loved ones safe. In the time that we've started this, a couple weeks ago, that team has been contacted by 44 different homes representing more than 3,000 Rhode Islanders. In each of these requests for assistance, here's how it works. First, the team makes a rapid needs assessment. And then, where necessary, a special unit of the National Guard gets deployed to the facility. Some of the things that the National Guard team has done, they lead training sessions for staff on infection control practices, including and particularly how to don and doff the PE. You know, there's a skill to putting on the masks and putting on the gowns and then taking them off safely. This is brand new for a lot of people who work in nursing care settings, so National Guard is teaching them how to do it. Coordinating the testing of all the staff and residents. So as of this past Monday, we've offered testing to every resident and every employee of every nursing home. Now, it's our commitment to test every employee of every nursing home on an ongoing basis. Our goal is every 7 to 10 days. So that's where we're going with this. We've been, sometimes the National Guard connects staff and residents with grief and trauma support and other mental health services. This is brutal. It's tough to be in a nursing home as it is. Now you haven't seen your loved ones in months. Your friends around you are getting sick. There's a level of chaos. We need to be sensitive to that, and we are sensitive to that. And that's something we're working really hard on, to connect folks who live in these homes with the mental health services that they need, and the workers. It's an incredibly traumatic time for the workers in these nursing homes, many of whom are very low paid. We are helping them develop safety standards and guidelines for each facility based upon the unique needs and layouts of every home. As I explained, some homes, there's one bathroom for a number of residents. Obviously, that's a lot harder to deal with infection control than if you have an individual bathroom per room. So we are making plans that meet the needs of each home. We've been connecting homes to staffing resources as needed through coordinated efforts of the Department of Health and the RI Responds. If you recall, RI Responds was something I launched at the very beginning, asking if there's any healthcare workers out there who are part-time employed or unemployed or retired, if they could help us out. So we're connecting nursing homes with that to make sure they have the staff that they need. Also through Skills for Rhode Island. A lot of these homes are experiencing staffing shortages for all the reasons that you can imagine. A lot of their staff are getting sick. So I wanted to give you a sense of this because the data is crystal clear. The hardest hit populations are the older folks, the sickest, the frail, and most particularly nursing homes. That is the reality of it. So we have to work overtime in order to help nursing homes do their job to keep their residents safe, living through something that none of them has ever lived through before. And we are on it, and we're doing everything we know how to do, and every day we get a little smarter, and every day we do a little more. But if you have a loved one in a home, especially one you haven't seen, I want you to know we are there working hand in glove and doing our best to make sure they have their physical needs met, their mental health care needs met. We're going to take very good care of them and do our very best to keep them safe. Especially now, I know it's hard, we can't allow you to visit, but I hope at some point soon we're going to be able to let you go ahead and say hello to your loved ones too. Okay, so with that, I am going to turn it over to Dr. Nicole Alexander-Scott to go through the data, and then I'll come back to answer questions.
Thank you, Governor. Good afternoon, everyone. I want to reiterate the encouragement for kids looking forward to summer camps starting several weeks from now after June 29th, as the governor has mentioned. This has been a challenging time for the kids in our lives, so being able to have something to look forward to that gives a little sense of normalcy will be helpful. It will be a new normal, so the kids out there can start thinking through creative cloth masks to wear and in anticipation of being ready so that we can get through this together. I also wanted to note that we are going to be working with cities and towns and organizations to make sure that all kids have safe recreational opportunities this summer, including kids who may not usually go to camp. So we have this focus for everyone from every zip code. As the governor said, we have 189 new COVID-19 cases to report today. There are 254 patients who are currently hospitalized. Of these 254 individuals, 56 are currently in the intensive care unit and 41 are currently on a ventilator. Very sadly, we have 18 additional COVID-19 associated fatalities to report. These people range in their age from their 50s to their 90s. 2 people were in their 50s, 2 people were in their 60s, 6 people were in their 70s, 6 people were in their 80s, and 2 people were in their 90s. As it's important to acknowledge, our sympathies, thoughts, and prayers are with the families of the Rhode Islanders who we have lost. I'm going to keep things brief today, but I did want to note that the Rhode Island Office of Healthy Aging organized a virtual Healthy Aging Town Hall to specifically address COVID-19 this morning. In addition to Rose Jones, the director of the Office of Healthy Aging, the governor participated along with Dr. McDonald from the Rhode Island Department of Health and Lance Robertson, who is the Assistant Secretary of Aging for the U.S. Department of Health and Human Services. It was a great event. It was an important event. A lot of great questions were asked and answered. Older adults and their loved ones can watch that town hall on the Facebook page of the Rhode Island Office of Healthy Aging, as well as on Capitol TV at 9:30 p.m. tonight. With that, we will get started with questions.
Actually, Dr. Alexander Scott, I have a question on the contact tracing app. There is a post going around on Facebook suggesting that if people sign up for the app, that potentially all their contacts will be shared into the app or somehow get to the Department of Health. Could you just explain to people how the app interplays with people's contacts, not contact tracing, but their actual contacts in their phone?
Thank you for that. There is no connection between the actual contacts on someone's phone with this app, Crush COVID RI. It is completely separate. And as we mentioned, and the governor really highlighted, privacy is of the ultimate priority with this app. So no information gets transferred indirectly or inadvertently or by mistake unless it is approved and determined by the person using the phone. And it's only really transferred if it's actually needed in a situation where someone tests positive and there is a conversation or a call from someone at the Rhode Island Department of Health. So there is no engagement or pulling of anyone's contacts from their own phone connected to the Crush COVID RI app.
Doctor, on the apps, the 25,000 who have downloaded it, do you know how many have actually uploaded the locator or enabled the locator?
We can see if that information is available. We don't believe that that mechanism is included with it. You can just really tell if someone has uploaded the app or not, but can't get any further into the elements of what's been involved within that.
Doctor, the app has certain technical limitations. It requires iPhone 7 or newer or Android 8 or newer. And according to statistics that I was able to locate, that excludes around 20% of people with smartphones. Is there going to be any concern about that or opportunity for a reduced capacity app for especially communities who haven't spent, frankly, about $200 for a handset?
Yeah, it's fully understood that some of the older phones may not work. That's why it's important for everyone to continue to provide feedback, because getting that information allows us to incorporate that into our planning for future versions. It's also why we want to make sure that people know if you have access to the internet, you can still go on to our health.ri.gov/COVID webpage and get connected to the same types of resources that are on the app for those that may have an older phone, or you can still call the COVID hotline. And it also allows me to reiterate what the governor reminded, that the full control that people have with this app is first from that privacy standpoint, as I've mentioned. It's also with just the ability to turn the app on or off. So there are opportunities to just determine that you don't want any of your location to be noted. That freedom is fully there as well.
Governor, back to nursing homes, are you seeing any progress as the rapid response team goes in? Is it actually helping? And on the testing, I know you mentioned today retesting the staff. Is there an effort to retest all the residents as well?
I'm actually going to let her answer that because she's in the weeds on this.
So the question of progress has been asked in the past, and it's an important one. We are slowly collecting that data and are starting to see, even with increased testing across the board and repeating the cycles of testing, slight decreases in the percent positive that are resulting. So that means we are fulfilling the goal of this, which is to continue to identify where there are residents or staff who are positive, get them the care they need, get them to be able to be isolated, get their contacts quarantined, and to continue to test to make sure that we are determining if there's anyone else at risk. So seeing slow decreases in the percent positive is a helpful trend. there's absolutely more work for us to do. With going forward, based on guidance with CDC, our federal partners, from a surveillance standpoint of continuing to understand the spread of disease, it is most helpful to continue to assess the staff on a cyclical every 7 to 10 day basis. We have a very low threshold for testing residents whenever we have concerns, symptoms, questions of exposure, or any of that. But our ongoing proactive testing really focuses on the staff because that gives us the highest yield to understand the spread of disease.
Governor, if I could just follow up. Yeah, if I could just, one more nursing home question. The percentage of fatalities in Rhode Island in nursing and assisted living facilities is about 80%, which people see that number, it's a high number, and some of the feedback we see on social media, people use that how they want to see it. That either means we're not doing a good job in nursing homes or we're doing a very good job outside of nursing homes and there's less of a need then for such restrictions in the general population. When you see that number, what do you think?
Yeah, excellent question. So when I see that number, I wish we could do better. You know, it's frustrating. Obviously, as you guys know, I have elderly parents. I have lots of friends whose parents are in nursing homes, and every day we're like, what more can we do? How can we get better at this? Having said that, when I look at, for example, the experience in our veterans home versus Massachusetts, I think we have to be doing something right here because we've had a much better experience. So I just, it's like the doctor said, you know, we need to help these homes with infection control. A lot of these nursing homes, the infection control is hard, first of all, and second of all, they weren't really set up for this, right? Like they're certified nursing assistants, they're not typically in the business of donning and doffing this PPE. So we're learning and we're helping. We are helping. They are getting better, but it's hard, and we have a lot more to do. With respect to the rest of it, I actually have the opposite take, which is the reason we've done such a good job with keeping everyone else safe is because people have been following the rules. So I look at those numbers, and I look at our curve, and I think this is good. It could have been so much worse. We could have very easily had, 5 or 10 times as many hospitalizations, and we didn't. And now as I look at reopening, I also feel that slow and steady wins the game. As frustrating as it is right now to not be open, in a couple weeks from now, we will be much more open. And if we do that, but we don't see a spike in the trend, that's a win. So, that's how I look at it. I'm much more worried about going too fast and having to pull back, which I think would be really crushing to our state's psyche and confidence and business confidence, than I am about going too slow by a week or two. Maybe that gives you a sense of how I think about it.
Governor, the April unemployment came out.
Yeah.
17% was slightly higher than the national average. Was that what you expected it to be? Yeah, it was about what I expected it to be. It's a horrible number, and I want to let people in Rhode Island know we're going to work until every one of you gets back to work. And for some of you, that may be in a different job. There are some industries, retail in particular, service industries, that are going to go through transition. And we are not going to let you get behind. It might take a little while to get you back to work. It is devastating to have a 17% unemployment, and we are going to stand this economy back up, and we are going to get you back to work. It's a little higher than the national average. That didn't surprise me. I'll tell you why it is. We knew that. I've been forecasting that. Rhode Island is very dependent on service industries, on small businesses. We have a very high percent of our economy is in businesses that are in 20 people or fewer. And those are the businesses all over the country that are the hardest hit. Also, we have a lot of folks who are in jobs that don't require a degree past high school. And those are the people who are getting the hardest hit. And frankly, those are the industries that are getting the hardest hit. So because our economy that looked like that, we got hit harder. But we're going to get people back to work. We are going to do it.
A number of employers are saying they're having a tough time. Their employees don't want to come
Yeah,
back
it's
because
a
they're getting
big-
the extra federal money. So what do you want to tell the employers? And also, it would seem then if people are doing that, that the number will remain that way from May, June, July until the money runs out.
So a couple things on that. I talk to employers every day. I try to talk to 6 to 10 employers every day. They're having a hard time getting people back to work. Some of it is people are afraid. So I talk to people who run maybe a large office complex, and people have been working from home. They haven't lost their job. They're still at home, getting paid at home. And their employers are saying, okay, let's slowly come back into the office. And their employees are saying, no, I'm good, thanks. I'm good working at home. No need for me to go back into the office. So the employers are saying to me, do more to give people confidence. More testing, more contact tracing, more what I was just talking to Brian about, like go slow, build confidence so we don't have to go back. The thing you're talking about is for the lower wage folks. And listen, I feel for those employers. I really do. So I am encouraging Rhode Islanders, if your job is there, go to work. You know, if it's there and it's safe, go to work. These unemployment insurance benefits were never intended to, they were intended to help you out if you lost your job. They weren't intended to keep you out of work if your job came back. And I'm hopeful that as we do a better job of getting PPE out, getting masks out, getting people to sign up for Crush COVID, that it's going to help.
Doctor, just kind of breaking down the numbers with respect to the antibody tests. If someone were to test positive, quote unquote, if someone were to test positive for the antibodies, is that number factored into the daily positive tests overall that we see, or is that a different set of numbers?
That's a different set of numbers. The testing that we have been doing with antibody tests under the guidance of our Rhode Island COVID testing and validation task force is really to help us understand more about the antibodies, which is where everyone is nationwide. There's still science that's needed to describe if you have a positive result. Does that mean you actually did have it before? Does it protect you from having it in the future? What can you do with that information? So we do not count that in our case counts. Our case counts are all the molecular PCR diagnostic tests that exist, and any testing that we're doing that's antibody testing is more so for us to learn and understand.
Going to release the number out of the 5,000, the initial tests that were sent out, the amount of people that tested positive for antibodies?
Well, we can say that about 750 people have actually been tested as a part of that, and we're still doing the analyses to be able to describe the overall, what we've been learning from the information.
Jordan. Governor, you've moved the National Guard away from checkpoints at airports, at borders. Where would you say you're concentrating their efforts the most right now?
Good question. In the nursing homes, with the support teams that I just described, testing. We still have, I think, over 100 guardsmen and women at the Twin River site every day. And then we still have URI, Rhode Island College, et cetera. Contact tracing. They're doing a lot of contact tracing. Contact tracing it's manual. So we're using technological tools to help them. But at the end of the day, it's someone getting on the phone and calling you and asking you who have you been in contact with, and then calling those contacts. So those are the three areas: testing, contact tracing, nursing homes, that they are heavily deployed.
Governor, quickly, have you had any reports of restaurants violating the guidelines?
I don't believe so. I don't think so. Not that I can recall at this moment, but I'll get back to you.
Governor, we had the Johns Hopkins University released an analysis that's gotten a lot of attention a day or so. And they said that on national that if the stay-at-home type of social distancing had been directed about a week earlier, there would have been about a 55% reduction in fatalities, and if it had been 2 weeks earlier, it would have been about an 83% reduction in fatalities. And in checking my notes, the first reference I found where you made a reference to 6-foot social distancing and things that we now know are common was in fact about a week earlier than almost anybody else. It was on May 11th at your press conference. And perhaps in a way that contributed to Rhode Island's relatively low numbers. And at this point, looking back over the last couple of months, do you have at this point now, a retrospective assessment of how you feel about that since it was a long time ago?
It wasn't long. It was and it wasn't. It feels like a lifetime, and it was weeks. So, look, Rhode Island is one of the most densely populated states in America, and we are stuck between two massive hotspots of this crisis, New York City and Boston. And we have many densely populated high-risk areas, Central Falls, Woonsocket, certain parts of Providence. And yet, our experience in terms of containing the virus has been much, much better than some of those states around us. To your question, Brian, I look at that as the good news, right? Because we acted aggressively and early, we got ahead of the virus, and it never really overtook us. Having said that, look, if I knew then what I know now, I would have shut down sooner. There's no doubt about that, but I didn't know then what I know now. The experience, look at Taiwan. They never let the virus run away with them. The experience of every place, city, state, country, that has effectively controlled this and not had their economy be crushed, these are the places that were ahead of the virus, put a lid on it quickly, and never let the virus run away. And so we did a pretty good job, relative to other places. I feel good about it. But if I had known then what I know now, I would have shut down sooner. Now, the name of the game, the reason I am obsessed with contact tracing and testing and mask wearing is because I never again want to have a 17% unemployment rate, relative to what John said. I want to open school in the fall. I do not want to close school again. And so we need to have the systems that like an early warning system. The virus is running away with itself in this community, in this zip code, in this manufacturing plant, and then we get right in there quickly and put a lid on it. I hope the goal is that we never again have like a whole state, and then we're back where we were, and hospitalizations are through the roof, and kind of the whole issue.
We did a town hall the other night with the members of Congress, and Senator Reid, I asked him, should the state wait to see if there's more federal relief to do the budget, or what? And he didn't, as always with
probably
Senator
said
Reid,
that
he was careful, but he eventually said the state might need to consider like a contingent budget or something because he's not super confident you're going to get another influx of cash before the end of the fiscal year. Can you just update us on your thinking about how you guys are going to handle updating, fixing the
Here's
budget?
what I think. It is very difficult right now to think about how to create a budget in light of so much uncertainty. Now, I realize that's our problem, and that's our job, and we will get it done, and I'll work with the legislature to figure it out. But, Speaker Pelosi's bill, which was passed through the House, would send billions of dollars to the state of Rhode Island. We could safely assume that bill won't get through the Senate as it is, but let's say if half of it does, or a quarter of it does. That's $1 billion swing for Rhode Island. So I'm waiting. Honestly, I am taking it a week at a time. Well, the Senate goes back in the first week of June. I hope they get back and do their job. And if they get us something, then, first, second, third week of June, let's get to work. I'm in favor of getting to work and getting a budget passed as soon as we can. If they can't get that done, if it's going to be mid-July, but we have some certainty it's going to happen, then, yeah, maybe we'll have to get creative. It's like a week at a time. You know, I talk to legislative leaders every week, and we are looking at it every week. So, you know, we are supposed to have a balanced budget passed by July 1st. That's the goal. If our senior senator says, you're not going to have relief until July 1st, then yeah, we might have to go month to month for a month.
Governor, Foxwoods and Mohegan, they've announced plans to reopen. Does that put pressure on Twin River? And is Twin River part of phase 2 or phase 3?
So I was disappointed and surprised to see that. And I know Governor Lamont has, I think, accurately called it an irresponsible decision. He said it's a very risky decision. Does it put pressure? Yes and no, right? It's unfortunate that that happened because it'll put us a bit of a disadvantage. We're not going to be ready by June 1st to safely reopen Twin River. Whether it's mid-June or July 1st, or I'm not quite ready to say. We're working very closely and collaboratively with Twin River. I got my eye carefully on what happens in Las Vegas next weekend to see how they do. So I think it's a mid to late June, early July kind of a thing in Rhode Island. Maybe it'll be appointment only. We're working really hard at it, but it's not going to be June 1st, and I don't think that would be responsible.
Does that run the risk then of Rhode Islanders go to Foxwoods,
Yeah, that is the
get
risk.
infected, bring it back, and you get the outbreak again?
I'm sorry. Yes, that is a risk. It's also a risk. I thought you were going to say people go to Foxwoods and stop going to Twin River. Also a risk, but I hope we won't be that far behind, and I hope that in a few weeks it'll be okay. But look, at the end of the day, that is a big risk. Opening up a casino, man, you better get that right. And if that takes us a couple more weeks to get it right, I would much rather be safe than sorry, for all kinds of reasons. I wanted to say something to Mr. Nisi. I've gone on the app. I have a lot of contacts. I have a lot going on my phone. And I'm doing it. And I'm encouraging Rhode Islanders to do it. So if that should give you a sense of my confidence level.
Can you just briefly then, because this, again, I got a text first thing this morning from someone saying, is this true? People are saying don't download the app because I don't want my contacts to go.
It's not true.
To the extent it's tracking you, it's following your, this might be for Dr. Augustine, it's following you on GPS if you allow it. Is that how it is?
That's exactly how it works. And as I'm listening to you, I think maybe I'll get a technology expert up here to answer these questions, because that is not who I am or who the great doctor is. It is exactly like what you just said. Think of it like Google Maps. So you allow it. It's called a My Location Diary. I clicked on yes, enable it. And then as you move around, and if you're in any place for more than 10 minutes, it logs that address. So that at the end of the day, you look at your location diary, and there'll be however many addresses you were at. That lives on your phone. By the way, I might know you can shut it off at any time. So if you're going someplace that you don't want people to know you're going, which I'm sure wouldn't be the case with you, you can shut it off. You can turn it on and turn it off at your will at any time. At the end of the day, it has a list of all the places you've been. And that just lives on your phone.
So it's places, not people. Like
Exactly.
you have to say who you saw at the addresses. When
That's
you
for your contact tracing notebook.
Right.
Yeah, it's just where, it's a log of addresses. By the way, just try it. If you have friends or people on social media, just give it a try. Try it for a week. Get yourself comfortable. If you're still squeamish, fine, shut it off. But I'm just saying, give it a try, because information is king in this, and preventing an outbreak is king. So if we have a quick log of your contacts and we can move fast, it'll help us.
Last question today from John.
Governor,
Well, you got it. Come on. We'll do 1, 2, 3.
do you want me to go first?
Well, I don't know.
I just wanted
John,
to,
Brian.
Governor, tomorrow is going to be, we're going to learn more about phase 2. Will that be, just so we know, funeral homes, hair salons?
You have to wait till tomorrow.
Okay. All right, well, I'm saying if there's a business listening and they want to
Yeah.
know if they,
Then you tune in tomorrow.
okay.
Governor, connecting what you said about what if you knew now what you knew then about the virus,
Yeah.
do you think some of these actions at nursing homes should have been taken faster? And do you think maybe there should have been a different policy on allowing COVID patients into nursing homes?
Look, we know, we've said this before, that there were some folks who were in the hospital who were released to nursing homes and released to more than one nursing home. And now we have moved to a system of COVID nursing homes, and that's the right system. You know, the whole thing here is segregate the sick. You want to segregate the sick, isolate the sick. And it took a little while to get to that system. That's where we are now. But I think we moved pretty darn quickly.
Governor, in talking to some of the local principals of high schools, I'm hearing that graduating seniors are thinking twice about what college to go to.
Yeah.
Because even though they've been accepted at a four-year institution, you know, 40,000, 50,000 tuition, suddenly CCRI looks very attractive.
Great. Go.
The question is, are you prepared for a wave of students? And where does your promise stand in terms of free tuition?
Here's what I would say, bring it on. So I hope people think URI and Rhode Island College and CCRI looks pretty good right now, because they are excellent educations at a excellent price. And we will be prepared to receive those students. And for next year, you know, promise stands as it is. To that point,
Don't they have to renew it? Isn't in your budget?
well, for this year's seniors he's talking about.
Oh, this year's senior?
Yeah.
Promise?
Yeah. To that point, I think college is going to look different for everyone. I think everything's going to look different forever, or for a long time. I think business will be a lot more work from home. I think school will continue to blend digital and virtual and technology with traditional. Same for college. And I think that's a good thing, actually. I'm spending time thinking about where do we go from here in a good way, right? Like there's a lot of innovation that's coming out of this. And once we get through the pain and suffering and get to the other side, there's some goodness. There's going to be new innovations, new business models, new ways to teach kids, new ways to deliver college more affordably, new ways to do business. And it's my job to figure out, how do I position Rhode Island to win? Like you could argue, big cities will be disadvantaged. So my job is to get Rhode Island in there and to be a hospitable place to do business once we reopen. Bye.